Hi everybody, welcome to this manual handling presentation provided to you by First Safety Solutions. I'm going to take you through this PowerPoint presentation with me, David Smith. I'll be your host, your narrator. I'll be taking you through the presentation and its content. We're going to be discussing everything associated with manual handling. So our course objectives, we're going to be raising awareness about the risks associated with manual handling, in particular back injuries. Highlight the legal responsibility to act in a way which protects the health and safety of yourself and your colleagues. Understand and practice the use of correct lifting and manual handling techniques and be able to demonstrate this. To provide a common understanding of the effective control and reduction of manual handling risk and prove competency in doing so. I suppose really the term manual handling is defined as the movement of a load by human effort alone, and that's really what constitutes manual handling in reference to the actual law itself. It impacts on you, a staff member, in different ways, and we're going to look at some of that over the course of this presentation. But these are our objectives, so this is what we aim to achieve as well. So throughout the presentation, we've got various questions and scenarios, but here's the first question here. What is manual handling? Is it handling a man, handling a phone, pushing, pulling, lifting and carrying? I think we can all safely say that we know the answer to that one. And if you don't, then I'll tell you. It's C, pushing, pulling, lifting and carrying. The next question we've got is approximately a third of all over 7-day injuries reported each year to the HSE the cause of manual handling injuries. I'll just quickly point out here that the HSE is a UK government agency responsible for the regulations or health and safety regulations primarily for the UK. It's responsible for the encouragement, regulation and enforcement of workplace health, safety and welfare. It also conducts research into occupational injuries and health as such. When we're talking about reported injuries, if an injury comes under a certain bracket of RIDDOR, then it must be reported to the HSE. So really, to give you a scenario, if you were to hurt your back or seriously injure yourself in relation to manual handling and you were off your work for more than 7 days, then it would have to be reported to the HSE. The HSE would receive the report, determine whether or not they would require further action, I suppose, or perhaps even come out to the workplace and investigate or review actually what went on and maybe look at, is there scope here for an involvement with the HSE? Do we need to enforce anything? Do we need to apply some of the legal statute contained in the manual handling regulations whereby we're asking the employer to improve its practice or maybe even provide a bit of awareness or training to the individual, really to stop that happening again. It might look at improvements to risk assessment, or it might deem that more training is necessary, or it might deem, they might deem that a mechanical aid or such is used. But really, that's what the HSE are there to do, as previously mentioned. So the question itself then, approximately a third of all over 7-day injuries reported each year to the HSE are the cause of manual handling injuries. This is true. Back injuries are due to lifting heavy loads is very common, and several million working days are lost each year as a result of this particular injury alone. Our next question, you're using a wheelbarrow to move a heavy load. Is this manual handling? Well, what do we think? A, no, because the wheelbarrow is carrying the load. B, only if the load slips off the wheelbarrow. C, yes, you're still manual handling the load. D, only if the wheelbarrow has a flat tire. So you can see there's 4 answers there, but I think we're all probably zooming in on answer C. Yes, you're still manual handling the load. Even though that you're using a piece of equipment to assist you with the load, I suppose, you're still actually manual handling the load. You're still pushing the load, albeit you're using a piece of equipment to, I suppose, alleviate the load in such a way whereby it's easier to maneuver, but you're still actually manual handling. You're still having to traverse that load over whatever terrain or area or surface to get it to the desired destination, but you're still handling the load. And we've got another question here. Really, the questions are just to get us thinking about manual handling as a whole and the different aspects that are associated with it. But this question itself, how many boxes can you hold at the one time? A, as many as you can. B, 1 of 2. C, you should be able to see over your load. Again, we're probably all zooming in on one particular answer there, and I hope it's C. you should be able to see over your load. If you can't see over your load, then you know that really it's not ideal that you're manual handling that. You can't see where you're going, your awareness is absolutely impacted negatively. Yeah, so hopefully you got C. So this next slide, we're looking at, or discussing rather, some of the effects of manual handling. Manual handling can cause injury through either a gradual accumulation of stress or from acute trauma. More than 30% of all reported accidents to the HSE are attributable to manual handling injuries. Risk factors that can contribute to the development of MSDs, which again is musculoskeletal disorders, are, we've got bullet points here, heavy manual labour, awkward postures, manual handling, previous or existing injury. We've kind of touched on that in the last couple of slides also, but these are some of the effects of manual handling if done incorrectly or not taking into account potential control measures, or maybe not having an awareness or having particular training. So, quick exercise here for you. List as many physical factors as you can that may contribute towards a back injury or back pain, obviously associated with the work that you do. What do you think? There's probably loads, especially the type of work that you guys are doing. I imagine you're bending over, you're stooping all the time, you're lifting things, you're moving equipment, you're reaching, and you're doing all these kinds of things that can potentially, I suppose, contribute towards back pain, or more severely, I suppose, a back injury. But what would you come up with? Did you come up with these? Heavy physical work, frequent bending, twisting, lifting, pushing, pulling, repetitive work, static postures, vibrations even. I'm sure that you came up with quite a lot of these, and I would think that quite a few of these bullet pointed references here are contributable to your actual undertakings for the duties that you're doing. So in this slide here, normally what I would get you to do, or select somebody to come and do a quick demonstration about warming up. It's really important to warm up before you undertake any activities associated with manual handling, like you would in the gym. You would warm up your muscles, you would get your blood flowing to prevent or to lower the likelihood of an injury occurring. Normally when I ask somebody to stand up and ask them, can you go and show us how you would warm up? And what they do normally is that they would stoop over and they would reach down and try and touch their toes and do it that way. But in actual fact, that's not the way to do it. The best way to do it is if you place your hands on the back of your hips and arch backwards slowly, as shown here, before you commence. And after handling a task, it's wise to perform this exercise 3 or 4 times. All you're doing is you're just standing up and you're kind of pushing your hips out with the hands on the back there. Like I said before, you would maybe go down and try and stoop over and try and touch your toes or lift your toes up a little bit to your fingers. You should really not do that. It puts too much stress on your back to do that, and it's not really a warm-up exercise. But take that into consideration. It's called the Mackenzie stretch. You place your hands in the back of your hips and arch backwards slowly, just gently. All you're doing is you're warming up your lower lumbar, your glutes, your hamstrings, all these sort of large muscle groups that you'll use in relation to manual handling. So take that under consideration, Mackenzie stretch. Another question for you, hope you've been paying attention. MSD stands for A, multiple strain disorder, B, multiple skeletal disorder, C, muscular skeletal disorders, or D, multiple skin disorders. What do you think? Are you going for B? Nope. Okay, good, because it's C. Another question for you. Upper limb disorders, ULDs. Hopefully you've heard of that before. Sometimes it's known as WRULDs, but in this course we refer to it as ULDs. It's more commonly, I suppose, referred to as ULDs, but the WRULDs is work-related upper limb disorders. But here we go. ULDs are aches, pains, tension and disorders involving any part of the arm, from the fingers to the shoulder or neck. I'm just thinking, is that true or is that false? It's true. Really, the ULDs describe a group of conditions which can affect, like it says there, the neck, shoulders, arm, elbows, wrists, and fingers. A couple of things to note here. Tenosynovitis, which affects the tendons, or carpal tunnel syndrome, affects your tendons as well through the carpal bone in your hand, very common one, or frozen shoulder. They're all examples of ULDs. They all differ, I suppose, in the manifestation of in the site of the illness, but there is a term that's commonly used to describe ULDs, and that's RSI, repetitive strain injuries. So we're moving on now to risk assessment. Risk assessments are required by law, even more so, I suppose, for the manual handling regulations, which is applicable to what we're talking about now. So they're required by law. They can help to reduce accident rates. Management can make an informed purchasing and budgeting decisions in relation to planning, expenditure, and staff training. I suppose dependent on the severity of a hazard coming to fruition will depend on what management want to take forward in terms of what's reasonably practicable. Remember that phrase again. The regulations specify 4 main factors which must be taken into account during the assessment, the risk assessment that is. These are the task, the load, the working environment, and the capability of the individual who's expected to do the lifting. So we'll look at maybe risk reduction now. It's important just to clarify from the previous slide that it's always the task that gets assessed in terms of risk assessment. From that risk assessment, then we can start looking at how to reduce risk. We do have an acronym that we can apply here called TILE, which is Task, Individual, Load, and Environment. So TILE, it's really an ergonomic approach, and it's generally required, I suppose, to design and develop the manual handling operation as a whole. But if we break it down a little bit, task. The task can always be improved by changing the layout of maybe the workstation, by example. If you were to store things at quite a high level, if you change that, whereby the things were getting stored at maybe waste level, then we're looking at the task itself. The individual, you have to look at the capability of the individual. Do they have poor health? Do they have medical record indicating that, that somebody is capable or maybe incapable of undertaking particular tasks? Has there been a period of sick leave or something like that? Obviously, when we're looking at the individual, we need to again apply that reasonably practicable aspect of it. The load itself should be examined to see whether it could be made lighter, smaller, or maybe easier to grasp or easier to manage. We could maybe look at, can the load be split? Can we, use a sling? Can we change position of handholds or something? Or maybe ensure the center of gravity is brought closer to your body, so to speak, to make it easier or more stable to move the load itself. And then the working environment, that could be improved in many ways. Is there space constraints? Can we remove space constraints? Can we reduce? Maybe something to do with the floor. Does the floor need to be regularly cleaned, or maybe the floor even needs to be repaired if it's damaged? What about the lighting? Obviously that's essential. Good lighting is essential in any workplace. Maybe working at more than one level, can that be minimised? So these are all things to take into consideration to look at reducing the risk as a whole. Furthermore then, just a little bit more on TILE. Risk reduction again, an ergonomic approach to reducing risk is very helpful, with consideration given to the task, individual, load, and environment. So the task itself, a couple more bullet points here, just I suppose underpinning what I mentioned previously. Yeah, so the task, keep the load close, minimise twisting, stooping, and fixed postures, reducing carrying distances, reducing height over which loads are lifted, reducing frequency of handling, avoid sudden movements, provision of handling aids. The individual, consider if unusual strength is required, maybe it's a super heavy load. Physical capability declines with age, unfortunately. Consider the individual's health status, touched on that, didn't we? Give special consideration to new and expectant mothers. Consider possible impacts of PPE. I suppose the positive impact and the negative impact. It's important to remember as well that if you're using maybe a particular pair of gloves for PPE, if you find that they don't offer the required dexterity or maybe grip, then perhaps they're not the quite right types of gloves to be using, and you've got a legal duty to inform your employer of that. After all, it's you guys that are doing the job, not myself or your manager or whoever. Reducing the handling tasks of individuals who might be at increased risk. Providing training to reduce injury risk. Training goes a long way. The load itself, use appropriate handling aids where appropriate. This includes handles, grips, or indents perhaps. Provision of information about the load. What do we know about it? What's its weight? What's its heaviest side? That's all important stuff. Reducing the size, reducing the weight, stabilising the load itself, ensure that vision isn't impaired. There was a question about that previously, wasn't there? And the environment. Good housekeeping is essential to keep work areas clean and tidy. HSE are always on about good housekeeping, and it can't go far enough. It's very true. Replacing steps with slopes so trolleys can be used. Providing automatic doors, ensuring floor surfaces are well maintained, avoiding handling in adverse weather conditions, and well-directed lighting will enable handlers to see clearly. And another question for you. You have to lift a heavy load. What must your employer do? A. Make sure your supervisor is there to advise while you lift. Do a risk assessment of the task. Nothing, it's part of your job to lift loads. Or the last one, watch you while you lift the load. Sure, that'll be off-putting, won't it? So I think we can all take from this then what the correct answer is based on the previous information provided. Do a risk assessment of the task. More to consider here. You have to carry a load down a steep slope. What should you do? Walk backwards down the slope to improve your balance. Carry the load on your shoulder. Assess whether you can still carry the load safely. Run down the slope to finish quickly. Yeah, okay, so we can see from there then, I think we all know that the answer we're looking for here is C. Assess whether you can still carry the load safely. If you need to quickly do perhaps a dynamic risk assessment whilst you're undertaking the work, then by all means do that. Stop and think, have a look. Maybe even if you're not sure, if it's something that you've never done before, then perhaps it is a question of, well, I'm really not sure if I can do this safely. However, I've got an idea how we can do it safely. So it's always really important to assess. Yes, you will have the risk assessment laid down by your employer, but if you can improve upon that or provide further analysis in terms of, you know what, your control measure does work. However, if we even add this into it, maybe it's a piece of PPE or something, then we can do it even safer. But it's really important that we assess if we can still actually undertake the job safely, depending on what other environmental factors are taken into consideration or present themselves. And to lift the load safely, you need to think about its size and condition. Yes, absolutely. Its weight, definitely. Whether it has handholds, yes, definitely. Or D, all of the above? Yes, obviously D, all of the above. Another one here. In a hurry, what speed is the safest way to move a heavy load? Fast, quickly, or walking speed? I'm not going to take a lot of time on this one. Definitely walking speed. So we're talking about ergonomics now, the ergonomic approach. Ergonomics can be better described as fitting the job up to the person rather than the person fitting to the job. Ergonomics looks at manual handling as a whole and takes into account a range of relevant factors. Physio-social factors should be considered when using an ergonomic approach. The scope of ergonomics and ergonomic assessment is very wide indeed. It incorporates a lot of the following areas, I would think. Personal factors of the worker, your physical factors, mental and intellectual abilities or attributes perhaps, your body dimensions and the competence in the task that's required. Maybe the machine or equipment that's associated under examination that you need to use. The interface between the worker and the equipment or machine controls, instrument panels, gauges, that's all taken into consideration for the ergonomic approach. Environmental issues affecting the work process, talked about lighting, and we've also got temperature, humidity, noise, or maybe some sort of pollutant that's present. The interaction between yourself, the worker, and the task, maybe the production rate, the posture that's related to that, or maybe a system of working, or the task or the job itself, the design of a safe system of work, checking that the job's not too strenuous or repetitive, and maybe the development of suitable training packages, how the work's organised, maybe it's to do with shift work, breaks, supervision. These are all included in the scope of ergonomics and what we mean by the ergonomic approach. As I said, it's very wide. But more about the approach. Automation or mechanical assistance can greatly reduce the risk of manual handling injuries. That's very true. Injury risk is reduced by either eliminating or reducing heavy forces or helping apply forces more efficiently. We're moving on to lifting techniques, very important part of manual handling. Probably the core part of it, I would think. We've got 5 points here. Think before handling and lifting. It's always important to have a wee think about what you're actually going to do before you throw yourself in. Yes, you've maybe done it 100 million times before, but there might well be different aspects in terms of the environment that you're doing that work in. Keep the load close to the waist, it's really important. Adopt a stable position, ensure a good hold of the load or on the load. Moderate flexion, which is really slight bending of the back, hips, and knees at the start of the lift. Okay, we've got a short video here. We can play this, and you can have a look at the video itself, and it's quite good in relation to what we've just been talking about, actually, about the lifting techniques. So take on board the message that it's putting across. So furthermore to lifting techniques, and after watching that video, we can also look at don't flex the back any further while lifting. Avoid twisting the back or leaning sideways, especially while the back is bent. Keep the head up when handling. Move smoothly. Don't lift or handle more than can be easily managed. Put down, then adjust if you need to. Makes all the difference if you need to do that. We've got some information here on lifting guidelines. There is no legal limit on what can be lifted. However, there are guidelines as stated in the manual handling regulations. Here we've got the male on the left and the female on the right, and we can look at the different values that are provided there, conducive to the actual body part, or in terms of how close the load is to the body, and in reference to when it's held away from the body. You can see there that the maximum one that the male can lift as a guideline is 25 kilograms, and that's at waist height, close into the body. And then for the female there as well, it's 16 kilograms. But remember, these are guidelines. Furthermore, in terms of the guidelines, there are combined capacities for males, 2 males there to share the load, and the guideline is 33.3 kilograms, and for the female it's 22.2. Obviously, shared load, sharing the load as a combined capacity. Remember, again, these are lifting guidelines. Got more guidelines here. There's a high risk of injury when lifting above the shoulder or below mid-thigh height. We can see there from the picture that the red areas there are high risk areas. The message really being avoid lifting from the ground where possible. Not always possible, I know, but where it is reasonably practicable, or where you can apply further measures such as lifting aids or equipment, then these should be utilised. More on lifting techniques. The centre of gravity, which is the point within the object where the total mass is concentrated, i.e. where the mass is probably the heaviest. Think about it. If you're drinking a mug of tea or coffee or glass of wine or something, pint of beer, at the start of it, when it's full, we usually lift higher up the glass or the cup, don't we? Later on, as the mass removes itself, as it's being drunk, we hold the glass of the cup perhaps lower down, don't we? And it's all about balancing the load. It's really important to take that on board, but think about the total mass, centre of gravity. So for lifting techniques, the forces involved, every time you bend or lean over to pick something up, you put tremendous pressure on your lower back. Normal guidelines assume the load is easily grasped with both hands, handled less than 30 times per hour, not supported for any length of time, handled by average men. The handling operation takes place in reasonable working conditions. The lifter is in a stable position. There is no twisting, pushing or pulling. The load needs to be reduced by 1/3 to provide the same degree of protection for women. If any of these conditions are not met, then the guideline weights need to be reduced, sometimes substantially. And that's really why there's no legal limits on it, because there's too much to presume or assume in terms of what we've just discussed here. So those guidelines we gave you a couple of slides back are all based on this information, these bullet points here. If these conditions are not met, then it might well be that the amount or the values within those graphs might have to change slightly, or be reduced substantially, as mentioned. I've got a picture here of a good technique for this chap here who's bending down to pick up his box. If you note his back, it's always straight, isn't it? It's really important to try and keep as straight as possible back. And again, another couple of pictures here. The picture at the bottom just kind of underpins the point I just made about the straight back. Think about it, your spine. The chap on the right there, he's totally stooped over, bent back. Think of the pressure on his back. The chap on the left, he's got a straight back. His head's up, he's looking forward. He's ready to engage himself to lift the load. And then the chap in the the picture in the top left there, the workman, he's using a technique to use the centre of gravity. He's grasping that post or whatever it is, that potentially the lightest part. He's moving it up and then he's securing it with more of his body, but at the same time he's trying to keep as straight as possible back. You can see here a couple of chaps lifting this bench. Good posture, bit of teamwork, heads up, back straight as possible, sharing the load. We've got more lifting techniques here. This chap here with his wheelbarrow, he's got a load in the wheelbarrow, he's got to take up a ramp, perhaps to skip or something like that. Look at his back. It's important to keep your back as straight as possible. The chap on the right there, he's bending his back, he's arching, he's levering backwards. Not great, but you can take on board the point that we're trying to get across here. Think about your back, think about your body position. And again, underpinning the previous point about the back. Different loads require different methodology of lifts. Lifting techniques: control the work environment, adequate space for manual handling, adequate hazard reporting systems, preventative maintenance programs. So we need to make sure that there's enough space for manual handling. We can't be doing it in cramped areas all the time. If you are doing that, then perhaps it is a case for the risk assessment to take on board your work environment. What can be done to alleviate that, to change it, to change the layout? Is there an adequate hazard reporting system? If there is, then you'll have an easy and efficient way of communicating the information that's required to the person that's in control of the risk assessment, perhaps. And if there is equipment being used as well, is there a maintenance program for it? Is it required? These are all important parameters to consider. And again, in the risk assessment, maybe there's scope to redesign work patterns to lower the risk of an injury happening, change the duration and frequency of a manual handling activity, break it up, rotate through different tasks with different actions and postures, to give your body time to adjust or to give you rest. Work rates, provision of breaks, is there cover for peak demand, and consider work hours. These are all areas that can be considered for redesigning work patterns. More on techniques: preventing back injuries, avoid lifting and bending whenever you can. I know it's not entirely possible all the time, but if you can do something whereby you don't have to bend or lift a load, then you should try and do it. Place objects up off the floor. That way you won't have to reach down to pick them up again. Raise and lower shelves. We talked about that, didn't we, about the workplace layout and all the rest of it. But the main aim there in this slide here is to give you information in terms of preventing back injuries. And we've got another question. How would you lift a box safely? Bend over and pick it up, keeping your back slouched over. Get close, bend down and pick up, keeping back straight. Or just pick it up quickly. I think we all know the answer there, don't we? Get close, bend down, pick up, keep your back straight. Where should a load you are carrying be positioned? At waist level, shoulder level, or feet level? The answer there is waist level. So it's important to point out that we always try to cultivate, I think, a macho image whereby, we don't want to be seen as the person who can't fulfill a task, or, if it requires a bit of strength or something, you might be the type of person to throw yourself into it. I'm not saying there is a new culture required within your organisation. However, it's important to keep that in mind, that just throwing yourself into it, and maybe you've got that slight bit of dread in your head. Oh my God, am I actually going to be able to lift this? Oh God, what are they going to think if I don't do it? You've got to try and remove that, terminate that thought altogether, because it's not about having a macho image. It's about applying yourself within the controls that are stipulated by your employer and doing what you're capable of doing. If you're doing something that it's a repetitive motion, you're doing it all the time, and you're starting to get a wee bit of pain, but you don't want to say anything, then you've really got to come forward and say, look, I'm actually starting to suffer from this. We need to look at something to put in place to try and alleviate this potential injury from happening. I'm not saying that is happening, but it's a good approach for you to take. There might not be a new culture required. However, the culture of this macho image, must stop at some point. This usually carries on from my last slide, overdoing it. Don't be afraid to say this is too heavy for me to lift alone. There's no point. Don't put yourself at risk. I mean, we've just talked about how the skeleton and the spine is such an intricate part of the body, and it's required essentially for us to go about our normal daily lives. So don't be afraid to say, this is too heavy for me. If I lift this, I'm really going to hurt my back. Just don't do it. It's important to recognise your physical limitations and abilities. Many people have injured their backs because they were afraid to ask for help. That's definitely true. If you have to twist or turn your body when you lift and place a load, it means the weight you can lift safely is more than usual. Nothing, you can lift the same weight as usual. You must wear a back brace. The weight you can lift safely is less than usual. It really means it's A, isn't it? The weight you can lift safely is more than usual because you know that you can lift that load. However, because you've got to twist and turn your body when you're lifting it, you're going to tire your body out perhaps a little bit more. The load is going to seem heavier. It's going to be more difficult to manual handle that load that you can normally lift easily. Another question, you need to move a load that is heavier on one side than the other. How should you pick it up? With the heavy side towards you, with the heavy side away from you, with the heavy side on your strong arm, with the heavy side on your weak arm. What do we think? I think we're all gravitating to the first one, aren't we? With the heavy side towards you. Think about the centre of gravity as well. The closer you hold something towards your body, the easier it is to handle. Bit of a humorous image there. This chap just casually walking along with his brolly, letting this person here do all the lifting. Might be beer, don't know. But yeah, don't be that guy. And again, this chap here just casually walking along, letting this lady carry the load. Not sure what that is, but it can't be good for her back. So again, if you can think about a different way of doing it, aids. Is there training maybe required? Is there different equipment we can use? Can you share the load? Can you split the load up? Lots of things to consider there, but yeah, I think you get the point, don't you? So we've come to the end of the course. Thank you very much for sitting through the content. I hope you got something from it. The main aim of the course really is to give you more awareness about reducing the risk of injury and how that injury can actually occur. So hopefully you've taken away some information from this which will allow you to go forward and really think about the loads that you're handling, how you can make it safer for yourself. Your employer will have manual handling risk assessments that will be or that can be used to try and alleviate the possibility of you being injured, to control the working environment, and obviously take on board the capability of you yourself as the individual. If you've got any questions at all, you can email me directly at First Safety Solutions, or contact Julia in the first instance as well to request information or further assistance in relation to manual handling. But thank you very much.